I don't know what these words mean. Lameness and sound?
You don't know what lameness means? What's going on, guys? Welcome in. I am Dr. Jim Cellini.
I am Dr. Michael Cellini.
I'm a board-certified practicing veterinary neurologist.
I'm a board-certified diagnostic and interventional radiologist.
And on today's episode, we are going to do another walkthrough. And on today's episode, we are going to continue to see if Michael's extensive knowledge of human physiology and anatomy will lead to him passing his veterinary boards.
I'm not sure why I signed up for this for round two, but I'm here for it.
So in the last episode I did, Michael did pretty good. I think he got 4 out of 6 questions. We're going to continue on with 5 or 6 more questions in this video, and these are taken directly from the NAVLE website and the Zuku Review website. Zuku Review is a great resource for veterinary students trying to pass the NAVLE. They give you daily emailed questions of the day, and they're probably the reason why I was able to pass my board exam back in December 2008. But it's a really great resource. Maybe if they want to sponsor this video on my channel, that would be amazing. So shout out Zuku Review.
Shameless plug.
Shameless plug. All right, let's get started with the questions. Question 1.
That's a long question.
I know, that's why I asked if you wanted to read it.
Now you can read it.
Okay. Michael's not as into this one. Michael, are you ready?
I think so.
Okay. An 8-year-old spayed female Chihuahua is evaluated because of a 6-month history of cough. The client reports that the dog's tongue occasionally turns blue during a coughing episode. His body condition score is 8 out of 9. Heart rate is 150 beats per minute, and respiratory rate is 28 breaths per minute. Palpation of the trachea elicits a dry, honking cough with a gag noted at the end of the coughing episode.
Can't say I ever do that in human medicine, but go ahead.
Okay. Thoracic auscultation discloses mildly increased bronchovesicular sounds. A lateral radiograph of the thorax is shown. Treatment with prednisone, theophylline, and hydrocodone fails to improve the clinical signs. Which of the following is the most appropriate next step in management? There's the x-ray.
Let's take a look at the x-ray.
Let's take a look at the x-ray. Let's see what the radiologist interprets on this dog.
We'll pop it up on the screen. Can I zoom in?
Michael is orienting the x-ray. I don't know how you describe that orientation, the way a person would be.
It's lateral, but I don't know.
Do you ever take lateral x-rays of people's chests? Is that a thing?
All the time, yeah. But I don't know why. All I see is the heart.
Figure this out.
Okay, let me see the answers. So the answer choices are aretinoid lateralization, intraluminal stenting. Wait, what? Oral administration of
Pimobendin.
Yikes.
What?
Pimobendin.
Parenteral administration of furosemide, sublingual administration of nitroglycerin. This is a hard question. Well, is it hard for you?
No, because I know what the dog has. So they give you an x-ray because there's something the dog has on his x-ray that is like clearly the diagnosis.
I wish I knew that diagnosis. There's nothing obstructing the trachea. Intraluminal stenting. Is that what they're alluding to here? If he's coughing and causing himself to obstruct his trachea, I'll go with that. B, because I don't know if medications will do anything. Intraluminal stenting.
That is correct. He's so good. Damn.
He's so good.
Pretty good. Basically what this dog has is a collapsing trachea. His trachea is like super narrowed right there. See right there?
Yeah, that's what I was looking at.
So if he's already failed all that medical management, then...
I was just saying if you're pushing on it and he can't breathe.
Right. It's probably narrowed. But yeah, good job. 1 for 1. Nice job, Michael. Do you have anything you want to shout out?
Follow me on Instagram and YouTube, Dr. Cellini, link up here.
Yeah. Nice. And
every time I do the answer, do I get the shout out? Something?
Yes, you get the shout out.
So that's
something.
one shout out. Follow me on YouTube.
Plug for every correct answer.
All right, good.
And also, don't forget to like and subscribe and follow this channel as well.
Right. And my channel.
All right. Question number 2.
We do a shorter question? Or
this one's shorter.
3-paragraph?
A 4-month-old mixed breed puppy is presented with a 1-month history of generalized wobbliness when walking, which I don't know why in a board exam you would use words like wobbliness.
That's something I would say.
I know. Wobbliness when walking and head bobbing when attempting to eat. Owners do not think there has been progression of signs, meaning in test terms, there has not been progression of signs. Based on the MRI findings, which of the following choices is the most likely diagnosis? Michael, please review this MRI.
I like the image-based questions.
Yeah,
here.
we're doing some image stuff.
So we have wobbliness. I'm immediately thinking about cerebellar pathology. but I mean, there's some T2 hyperintensity about the cerebellum. Maybe it's atrophied. I don't know what a normal one looks like. The questions are lead toxicosis, distemper encephalitis, Chiari malformation, cerebellar hypoplasia, or normal MRI. Well, I'm not going to go with normal. I mean, compared to a human brain, it looks hypoplastic. This is what I'm going to do. We're going to rule out the top two because there's no flare findings.
Things a radiologist knows that a fourth-year vet student probably doesn't.
So we're going to completely rule out those. It's not going to be normal. So it's either going to be a Chiari malformation, which I don't see. I'm going to go with hypoplasia because I feel like I can see the gyri, like less gyri.
That is correct. 2 for 2.
Look at the test reasoning deduction.
All right, so yeah, that is cerebellar hypoplasia. So some other clues here being that it's non-progressive, started at an early age. Michael, you're 2 for 2. What would you like to plug with successful answer number 2?
It's my Instagram. Follow me, DRCellini on Instagram.
DRCellini on Instagram.
There's two plugs.
Where Michael looks pretty.
Bring back Instagram.
All right. All right, question number 3. This one's easier. Which one of the following therapies would be most useful to treat a dog with suspected head trauma and cerebral edema?
I mean, we do this in
phenobarbital, mannitol or hypertonic saline, sodium bicarb, then a CSF tap, or isoproterenol.
I'm not going to overthink this. B, mannitol and hypertonic saline.
That is absolutely correct. That was a little bit of a softball, but
that was a softball.
The other options are so obviously bad.
Yeah, I didn't even read the other ones because I know the answer to that.
Right.
We had that a lot on our boards. About
a lot of head trauma stuff.
Yeah, a lot of patients with cerebral edema.
People get head trauma?
Yeah, shockingly, yeah.
All right, so that's question number 3.
And he gets a shout out, and his third shout out is... What's my shout out?
Do you want to list your place of employment for everybody?
No.
Bitcoin.
Oh yeah, use this Webull link in the description below and you get 6 free stocks. If you deposit 1 cent.
1 cent onto Webull.
You can get up to like $1,500 in free cash, by the way. But, you know.
Nowadays, it's called WeBear.
Yeah. Ooh.
No. All right. Question number 4. Michael's 3 for 3.
That's pretty good.
A 4-year-old rat terrier is presented with a 3-day history of progressive stumbling and falling. Physical exam reveals a right head tilt, left-sided hypermetria, generalized ataxia, and a vertical directed nystagmus.
Okay.
Which one of the following choices is at the top differential list? Central pontine myelinolysis, fibrocartilaginous embolism, ascending and descending myelomalacia, granulomatous meningoencephalitis, or amyotrophic lateralizing sclerosis. This is the most wordy option choice.
Yeah, it really is.
This is basically just like, how does each one of these diseases present?
I'm between 2. I don't think it's infectious. I don't think it's an embolism. It's a 3-day progressive. It's not that. So I'm going to go with central pontine myelinolysis.
Incorrect. You do not get a plug this time. This is consistent with granulomatous meningoencephalitis.
Granulomatous.
Or GME, as we call it.
How is this infectious?
Not the stock GME, but GME. So this is not infectious. So you don't know this.
It's chronic.
This is autoimmune disease. So this condition is an autoimmune brain inflammation in pets. We see it all the time. I diagnose this like once a week. But yeah, that is the one option that is by far the most likely. Fibrocartilaginous embolism, or an FCE, results in individual limb weakness. Like one or more limbs are just like weak or paralyzed. Myelomalacia is a spinal cord problem too. ALS, we don't really, like, there is an ALS in dogs.
Yeah, that's what I was like, whatever.
I mean, there kind of is, but it's not really. And degenerative myelopathy, shout out. And then central pontine myelinolysis, I just don't think is quite as multifocal from what they're saying.
I was really focusing on the one thing. Because that was like a buzzword for us. I forgot what disease process.
Yeah, I mean, I don't know if that's necessarily, it's like impossible for that to present this way. So,
I mean, it might be a bad question.
That's a little iffy. It might be a bad question. You're right.
We'll still be 3 for 4.
All right, so let's do...
No plug. Is that a horse?
Yeah.
Okay. Don't know anything about that.
Which type of immune reaction is occurring in this picture of a horse with limb edema secondary to localized vasculitis? I'll put the picture up here.
And I'll take a look at it.
We'll take a look at this limb of a horse. It's very swollen.
Yeah, we have a swollen limb here. It looks like a localized edema or something. So immune reaction. Oh God, I used to know all this stuff. So I don't think it's 3. Actually, is it? If it's a vasculitis, I'm trying to think. I'm trying to go back to like 10 years ago.
Yeah.
So I think if
You made a video about studying for boards, right?
a long time ago, it's not. I don't think it's this because it's chronic. I think it might be 3. I'm gonna go type 3.
Type 3. That is correct. In type 3 reactions, antigen antibody complexes are deposited into the endothelium, stimulating complement and a neutrophilic inflammatory response in vascular damage. Look for localized or multisystemic vasculitis.
See?
There you go.
Still got it.
And then they list some other diseases here.
Still in there. Still in there somewhere.
Is there anything else left to plug at this point?
No.
Your whole life has just been plugged.
TikTok. I didn't plug TikTok.
Oh, TikTok.
DRCellini
on TikTok. Any chiropractors you'd like to recommend on social media? Me neither.
I would not. Actually, there is one guy.
Yeah, you're right. Aaron Kubal.
Yes.
Doctor of chiropractic.
He's the best.
He is the best. And I'm trying to do a collaboration TikTok video with him.
He's a real one.
If you're watching this, Dr. Kubal, I'm not sure how to pronounce it, I would love to react to other veterinary chiropractic videos with you. Please contact me so we can do this.
Yeah, he's a real one.
I want to do like Mystery Science Theater 3000, but we watch chiropractic videos and just comment on it.
And who's talking? My radar. At the time, it must have been approaching Point
We
Barrow.
hearing voices?
Walter Mondale arrives.
A rare Godzilla-free day.
All right. Final question. You're what?
4 for 5.
5 for 6?
4
4 for 5. A 15-year-old quarter horse mare is presented for right front lameness, grade 3 out of 5 on the lameness scale, meaning lameness is consistently visible at the trot.
What do you mean? It's like lame? Like it's a lame horse?
I think that's all that means. I don't know why they clarified at the trot. She becomes sound after an abaxial nerve block. Radiographs of the distal limb look like this.
Well, I don't know what these words mean. Lameness and sound?
You don't know what lameness means?
I mean, I know lame, like, oh, that person is not cool. They're lame.
Oh, so you do. Radiographs of the horse's foot look like this. I'll put the picture up here.
Wait, what was the question statement? He's lame?
It basically is a lame horse.
He's not cool. He's not cool. He's lame. He's trotting?
You don't know what lame means?
What? I've never, not the medical definition of lame.
They
lame
don't call people lame when they like can't put weight on a foot?
No.
What do they say?
Uh,
Like if you tear your ACL and you can't walk because you're limping.
yeah, not able to put weight on foot.
That's not lameness? You don't call that lameness?
I think if we called a human lame, they'd be like, what'd you say?
Any orthopedic people out there or just like other types of doctors in general, please let me know if this is true or not.
We don't say lame. If I came up to your room, you weren't medicine, and I was like, hey, you're lame. They'd be like, what'd you say to me?
Okay, but there's
What'd
a
you
lot.
say to me?
There's a
They say inability to bear weight.
okay.
Yeah. So this horse is lame.
This horse is lame, and this is the X-ray of the horse's foot.
What is the question? What's like arthritis or an avulsion fracture?
All right, here are the options: pedal osteitis, high ring bone, spavin, chronic proliferative synovitis, or exostosis of the second metacarpal. I'll let you look at it again.
What is sound? Becomes sound.
Like they're walking normal.
I don't know what spavin mean. That kind of.
I forgot what spavin or spavin? I forgot what that is.
I mean, there is exostosis there, but
There's going to be horse people that comment like, how do you not know what spavin is?
So it has to be either a reactive type picture. So it could be osteitis or synovitis. So we're going to go with pedal osteitis, final answer.
Pedal osteitis, final answer, and that is incorrect.
Idiot!
So you're 4 out of 6 again.
Is it synovitis?
This is an example of high ring bone, which is periosteitis and osteoarthritis of the proximal interphalangeal joint leading to exostosis.
So I was right. I literally said
What did
that.
you say?
I said it looks like osteoarthritis there. What's like arthritis or an avulsion fracture?
Yeah, but you chose osteitis.
Yeah, because there was no option for osteoarthritis.
Well,
I know high ring bone means OA. Arthritis type picture. High ring bone.
I don't know.
This patient has high ring bone.
Yeah, these are kind of what horse terms end up being. Anyway, here's a picture of a arthrodesis.
Yeah.
For the fact, I'll put that picture
quite,
up here.
Quite a bit of work for that.
That is quite a bit of work. All right, so Michael is 4 for 6, which should, according to math, I think yield the same percentage of 66%. Michael continues to be a D student, and you know what they say about D? D is for DVM. Michael is able to practice veterinary medicine. Congratulations yet again. All right, do you have anything you want to plug before we go? Anything left to plug?
No, just follow my social medias.
Follow Michael's social medias. Follow my social medias. I hope you enjoyed this. Let us know in the comments below if you want us to go over other topics in relation to veterinary or human medicine. And yeah, we'll see you guys next time. Like and subscribe to everything that we do, please. Thank you.
Follow our podcast. That would be my next.
Yes, follow our podcast, Cellini Rounds podcast.
Rounds.
Put the link right there. Boop. There we go. Cellini Rounds. Ignore Tommy. Tommy's a non-factor. He does nothing to help with any of the podcasts or social media whatsoever. He is what we call the parasitic youngest brother. So,
yes, correct.
Shout out to Tommy.
Yep.
All right.
All right.
Have a good one, guys. See you next time.